This is a condition that I want to talk about because I want you guys to be educated that it's not really a disease. So typically we see what we call puppy vaginitis in pups that are 6 weeks to up to about 6 months of age. It's an accumulation of mucoid to mucopurulent vulvar discharge in an otherwise asymptomatic puppy. So the key is these puppies are not bothered by this discharge. Their owners are. And I always groan when I reach over to pick up a puppy off the floor for their first puppy exam and a big glop of mucoid discharge comes out, which the owner then notices for the first time and is horrified, and they're sure that there's something very seriously wrong. So it's a mucoid vulvar discharge without any other clinical signs. So they don't have polakiuria or dysuria. They're not licking themselves excessively. They're not scooting. They don't have any marked perivulvar dermatologic changes. They just have this discharge, and it sometimes causes some matting of the fur in the perivulvar area, but otherwise they're completely asymptomatic. So again, important rule-outs in a young female puppy are, number one, urinary tract infection. We do see bacterial cystitis in female puppies. It's because they have a very short urethra, and it's very easy for bacteria to ascend up that urethra, and this is not something you want to miss because it can turn into a pyelonephritis, and you don't want to have that go undiagnosed and cause chronic renal damage. In my part of the country, we get foxtails in vulvas, and causes signs of mucopurulent discharge, but typically these dogs are paying attention to it, licking. They may have actually more of a hemorrhagic purulent discharge than just the pure mucus. Again, you have to remember these are puppies, and this is the time when you can make a diagnosis of ectopic ureters if it's there before it's gone to the point where you have hydronephrosis and permanent damage. And the initial estrus cycle can start with a mucoid discharge. So those would be my main rule-outs. What causes puppy vaginitis? We don't know. We surmise it's just an imbalance of the aqueous versus the mucoid part of the normal vaginal mucosal glandular epithelium. How do you diagnose it? Well, primarily by your history and your physical exam. This is where it gets a little bit dicey, though, because these are puppies. And when you ask a client, is she urinating normally? Does she have increased frequency of urination? They're going to say, no. Well, maybe yes. No, I'm not really sure. She goes outside, she urinates, then she goes back in the house and she urinates again. Well, she's a puppy, so sometimes it's really hard to figure out if you're dealing with housebreaking issues or whether she's really polakiuric. If they're walking around the room while I'm taking a history and they haven't sat down and licked themselves, then I would assume that they're not licking excessively. But if they've sat down and licked themselves 3 times during the course of my history taking, then I would say yes, they're paying more attention to their vulva than they should be. Usually I say you can make this diagnosis based on your history and physical, and if you're worried about it, at least do a urinalysis and make it a urine sample that you get by cystocentesis so you can accurately read through the presence of any bacteria or any growth on your culture. And if you've ruled out urinary tract infection in most of these cases, then you can simply advocate that this is probably puppy vaginitis and it's not a big deal. If you do a lot of other diagnostics, you're going to probably scare yourself. If you do cytology of that discharge, you're going to be really alarmed because it's going to look like this. It's going to have tons of white blood cells in there, and you'll be convinced that must mean there's an infection here or a foreign body or something bad. But if you look at the neutrophils, they're really healthy. They're not degenerate. They don't have bacteria intracellularly. They're just sterile inflammation. I don't advocate doing vaginal cultures on these guys. It's not a bacterial disease, and if you do vaginal cultures in puppies from the same litter that do and don't have signs of vaginal discharge, they're all going to grow the same flora. So, and unless you're really concerned about potential ectopic ureter or incontinence, you don't need to do ultrasound or any kind of contrast study on these little guys. How do we treat it? 101 uses for baby wipes. These clients are going to want to do something. So tell them just to keep the perivulvar area clean with something like a baby wipe, and it will go away with time. The prognosis is good. It is not correlated with the development of adult dog vaginitis. It's not a reason to postpone spay. If you're an advocate that dogs should be spayed before they have their first heat cycle or before their second heat cycle to decrease the chances of mammary cancer, the presence of puppy vaginitis should not change your practice, even though that's what Vin sometimes says. When does it go away on its own? If you look in the literature, you'll see that it says goes away with puberty. Okay, puberty meaning first heat cycle. It also says goes away with spaying. Obviously, no hormones. Endocrinologically, completely different end of the spectrum events. So it probably just goes away with maturity and tincture of time.